Good morning. I asked to be allowed to remove my face mask. I do this because people see us talking in the media without our face masks and then think that they don't have to wear them. But that's not true. Quite the opposite, in fact. Face masks are essential. I removed my face masks to be able to communicate and to be understood clearly. But it is essential that everyone continues to wear their face mask in order to protect oneself and those around them. Today, we want to call attention to the regression we have seen in our control of the virus following recent episodes of local transmission. Above all, in the provinces of Havana and Artemisa, where a considerable number of cases have been detected over recent weeks. This represents a reversal in the level of control we have managed to establish across the country. We all know that human health is a public good, and we are all responsible for protecting it. We have to understand, and this is something I've stressed on numerous occasions, that the virus is among us and is highly contagious, and the majority of the population are at risk of infection, which means that the epidemic can grow, especially in areas where people fail to adhere to measures outlined for each specific phase. It can also complicate the situation, just as we have seen in the two aforementioned provinces. So it's down to each and every one of us, because the virus doesn't discriminate based on age. It affects children, young people, the elderly, pregnant women. Today, the majority of cases are young people, and these young people then pass the virus on to elders at home. And although older folks are more susceptible to the virus given the likelihood of underlying health problems, all of us are at risk of falling seriously ill. This is why we reiterate the importance of adhering to all the measures in order to effectively control this pandemic. When I mentioned that the virus is highly contagious and easily spread when measures fail to be adhered to, well, this is exactly what has been happening over recent weeks in Havana and Artemisa, which naturally puts the entire country at risk. Yesterday, 18 new cases of local transmission were diagnosed, in addition to 41 imported cases, for a total of 59 positive cases yesterday. Of the autochthonous cases, 4 are from Artemisa and 14 are from Havana. Dr. Durán will go into more detail about these later, but I mentioned them so that we understand that a considerable number of cases are still being reported in the country, even though there were fewer cases of local transmission diagnosed yesterday than the day before. To get a better understanding of the situation, I want to share with you some statistics in order to truly appreciate the importance of the measures being taken by the country in response to this new spike in cases. If you look at this first image, showing the number of confirmed cases per day, we can see that since it began, the pandemic reached its peak between the 12th and 18th of April, as highlighted in red, with the highest number of cases reported in April and May. Now, look at the end of the chart. As of the 21st of July, we have been seeing a growing number of daily cases, putting us in a very complicated situation. Today, 356 people, or 12.3% of all confirmed cases, are hospitalized in Cuba. Think about that, when this number had fallen to 2% in previous weeks. Unfortunately, as the number of confirmed cases increases, so does the number of patients reported as serious. Today, we have 7. This is why we are reiterating to all Cubans, although I've spoken mostly about the 2 provinces facing the most difficult situation, that everyone in every province must continue to take great care and comply with the appropriate measures considering that a significant number of people are asymptomatic and that there has been a considerable movement of people across the entire country in recent weeks. We are seeing a resurgence in the virus, putting the entire population at risk. If we can show the next image, please, you will understand what I'm talking about. This graph shows the behavior of the virus in Cuba week by week. As you can see, from the 27th of April, or week 18, when we had 280 cases, the number of cases began to decline up until 2 weeks ago. We can see how, through implementation and adherence to COVID-19 response measures, we've managed to contain and control the virus. This has not been the case, however, over the last 2 weeks. If we move on to the next image showing the behavior of the virus by month, as you can see, cases increased from June, where the lowest figures had been recorded, to July. But now in August, we have already reached 255 cases, meaning that in the first 8 days of August alone, we have already recorded 90% of all cases reported in July, a figure which is sure to keep rising. In conclusion, let me stress the importance of complying with all health measures, because the use of face masks, social distancing, and hygiene measures, above all hand washing, are all simple actions that can stop the spread of the virus. Therefore, we are calling on the population to continue adhering to these measures, no matter what phase your province may be in, because they are vital to our individual and collective protection. We must understand the danger this virus represents and act accordingly. Anyone suffering from respiratory symptoms must immediately seek medical treatment. And it's not just the risk that you may pose to those around you, but also everything that we have achieved through the work of our scientists and medical professionals means that the longer you leave it, the greater the risk to your life. Timely treatment means a greater chance of saving lives. And although the number of serious cases has declined and our mortality rate is dropping, this doesn't mean that people will not continue to fall seriously ill and potentially die of the virus. We health professionals will continue to fight this battle for life. And recalling the words yesterday of our President in the closing statements of the temporary COVID-19 response working group, we've got to go that extra mile, just as we Cubans know how to do. In order to defeat this highly contagious virus, we must understand that we have to act responsibly and work together to defend ourselves. Now I'll pass over to Dr. Durán. Thank you for your attention. Good morning. Excuse me while I remove my face mask. Good morning, Mr. Minister. I think you have clearly shown the seriousness of the behavior of the pandemic over these last few weeks. Today, like always, we are going to report on the situation in Cuba as of yesterday. Yesterday, bearing in mind the number of confirmed cases, associated contacts, and suspected cases, 773 people are hospitalized in Cuba. 22 are under observation. There are 395 suspected cases and 356 confirmed active cases, among the highest figures we have seen over recent weeks. In our primary healthcare system, 11,220 people continue to be monitored by our professionals and specialists. Yesterday, 3,657 samples were processed in our various molecular biology laboratories in order to detect the virus. 1,701 were processed at the Pedro Curi Tropical Medicine Institute, 564 in Havana's Hygiene, Epidemiology and Microbiology Center, 403 in Villa Claras, 280 in Santiago de Cuba, 335 in the Hermanos Almajeras Hospital Laboratory, 280 in the Genetic Engineering and Biotechnology Center Lab, and 94 in the Civil Defense Laboratories. We have increased testing in order to detect the highest number of infected people as possible. Of the samples processed, 59 tested positive for SARS-CoV-2 and COVID-19. This brings the total number of samples processed in the entire country since the pandemic began to 293,069, of which 2,888 have tested positive for the virus. Yesterday, samples were tested from all of the country's provinces, the most from Havana, with 2,584, 270 from Artemisa, 154 from Villa Clara, 138 from Santiago de Cuba, and so on and so forth from all of the country's provinces. Of the 59 positive cases diagnosed yesterday, all are Cubans. 16 positive cases yesterday are confirmed case contacts. This brings the total number of confirmed case contacts to 2,424, or 85.2% of all diagnosed cases, making it the highest risk group. Of the 59 cases, 41 contracted the virus abroad. And, as I always state, Cuba's protocol, which sees all these people taken to isolation centers and tested for the virus, means that they do not come into contact with the general population, therefore preventing the spread of infection. The 41 imported cases yesterday mean that a total of 280 people contracted the virus abroad, representing 9.8% of all confirmed cases in the country. The source of infection linked to 2 of the 59 cases yesterday is yet to be determined. Work is underway to locate the source in order to identify all possible case contacts. This brings the total number of cases where it has not been possible to determine the source of infection in Cuba to 137. 48 people diagnosed yesterday are male for 50.3% of all cases. Meanwhile, 31 are female, representing 49.7% of all diagnosed cases. The rate between the two sexes is practically the same in Cuba. 50 of the 59, or 84.7%, were asymptomatic at the time of testing. This is something the minister touched on, just how dangerous the virus is, because an absence of symptoms means that it's impossible to know who has it and who doesn't, making the likelihood of transmission a lot higher. These cases account for 56.7% of all positive cases on the island. Therefore, if we didn't screen case contacts, if we didn't screen groups at risk, you can imagine the level of transmission we would currently have in the country. By age group, of the 59 positive cases yesterday, 27 are between 20 and 49 years of age, and 32 are between 40 and 60 years of age. No children or people under the age of 20 tested positive for the virus yesterday. Nonetheless, in Cuba, 323 young people, children, even infants under the age of 1 have been diagnosed with the virus to date, of which, and given their positive response to treatment, 294, or 91.02%, have been discharged from hospital. Of the 59 positive cases yesterday, 18 are autochthonous, the result of local transmission, while 41 are imported. The imported cases belong to the provinces of Villa Clara, Granma, Guantánamo, Holguín, Santiago de Cuba, Camagüey, Cienfuegos, Sancti Spíritus, La Habana, Matanzas, Pinar del Río, Ciego de Ávila, and Las Tunas, from practically all of the country's provinces. Of the 18 autochthonous cases, 4 belong to Artemisa, 3 to Mariel, and 1 to San Cristobal. The 14 cases from Havana belong to the municipalities of La Habana del Este, Boyeros, 10 de Octubre, San Miguel, La Lisa, Guanabacoa, and Playa, which, as you can see, and as I commented on yesterday, reflects the dispersion of the virus. If we look at the confirmed case rate per 100,000 inhabitants over the last 15 days, Artemisa tops the list with a rate of 20.78, followed by Havana with a rate of 9.60, then Villa Clara with a rate of 1.16. Cuba's rate per 100,000 inhabitants also rises to 3.01 over the last 15 days. To summarize, of the 2,888 people who have been diagnosed with the virus thus far in Cuba, 356, or 12.3%, are active hospitalized cases. 349, or 98%, are clinically stable. No deaths were reported yesterday in Cuba, nor over the last 4 days. Cuba, therefore, has a mortality rate of 3.05%, which, compared with the regional rate of 3.7% and global rate of 3.74%, places Cuba in 21st position in the Americas and 113th in the world. As I always mention, 2 patients were previously evacuated at the start of the pandemic. Yesterday, 13 people were discharged from hospital. This is a disappointing result when compared with the number of positive cases diagnosed yesterday, and is why there are still so many active hospitalized cases. This means that to date, 2,442 people, or 85% of all confirmed cases in Cuba, have recovered from the virus and are back at home or undergoing the 14-day mandatory monitoring period. As the minister explained, the number of serious patients has risen. This is the risk we face with the increase in cases. Yesterday, another patient was reported as serious, bringing the total to 7. This is the situation in Cuba. I don't think there is much else that needs to be said, only that I reiterate what the minister said, that it's a question of complying with the measures which are being applied throughout the country. And we will overcome this pandemic, but only with the effort and collaboration of all. Now we're going to turn our attention to the world. The total number of COVID-19 cases worldwide surpassed 19 million yesterday. It currently stands at 19,076,745 after 283,223 people were diagnosed with the virus yesterday. Yesterday, a high number of people died of the virus, over 6,000, 6,903 to be exact, for a total of 714,618 COVID-19 fatalities and a mortality rate of 3.74%. The region of the Americas, which has been the epicenter of the pandemic over recent weeks, accounts for 54.06% of all cases worldwide, after 157,352 new cases were reported yesterday, for a total of 10,313,590 confirmed cases. A high number of deaths were also reported, 4,912 fatalities in total, bringing the COVID-19 death toll in the Americas to 328,002 and a mortality rate of 3.7%. Just like yesterday, the United States reported almost 2,000 deaths, 1,848 to be precise. Brazil, which follows the United States on the list of countries with the highest number of cases, reported 1,237 COVID-19 fatalities yesterday. This is the information that we have on the behavior of the pandemic in Cuba and the world.